newer barracks and about your every night going out and all that sort of thing. Do you remember the bands? As I understand, the 93rd and the 92nd both had what I've read, terrific bands.
But first they had what they call Special Service Command. SCU was the initials, and I've forgotten what it stood for. But many of the performing artists, black performing artists in America, went through Fort Huachuca. So in the Special Service Command, there was always a group of people like, I don't know if you know of the Mills brothers. John Mills was out there as a soldier. The Nicholas brothers, those dancing guys. Fayard was there. Now the other one was not. Fayard was my patient at one time because he couldn't perform. He just wanted to pull one to get back to New York. Oh, his hands, he couldn't perform. Anyway.
Oh my gosh.
But we
had really had to come into the hospital for psychiatric or physical evaluation?
Psychiatric, because, you know, he wasn't creative and stuff. But anyway, to answer your question, I can't think of them all, but let's just say members of many, like bassist band, many of the black performing artists went through Huachuca. So at some time or other, there were people there, and there were always bands. And every Saturday night, we had dance where one of the bands performed, and it was made up of, you know, different people from the service command unit, whoever was busy there or doing something. But usually we had the jukebox with everything. We had this lovely club that every night, you know, they had a bar and danced and upstairs that, you know, you could corner off with a few people or be down with the big gang if you wish.
So it was a jukebox during the week, but on the weekends it'd be...
every Saturday night until 2 a.m. Sunday morning was a dance with the band playing.
Did you ever go to any of the dances that were in Ramsey Canyon? Like you'd get in a truck and drive over that was...
No, it wasn't known to us. Maybe people did. What we would do if we weren't there, a number of us would go to Tucson, Arizona. Tucson was about 90 miles away, and we'd go there because there were places to see. Phoenix was a little farther away. I got to Phoenix a few times for sightseeing and everything on the mountains. I think at that time I hadn't seen mountains bigger than what I saw in Texas, and it isn't huge, but at least you could stand on the mountain and look down on Phoenix. And we'd go there sometimes, and then around to Tombstone and all of the historical places that we knew about.
Bisbee,
Bisbee. Well, see, Bisbee, you'd run over there to buy something off of the post. Or we could take the bus to, from Huachuca, buses ran to Phoenix, to Bisbee and places. Douglas, right. Right.
Yeah, and there was another military town that was up the way or something like that.
Yeah, maybe it'll come to me. Because we had a epidemic of silicosis. It's like irritating the lungs, like it makes it look like you've got TB. The people, Douglas, Arizona. Did I say Douglas? Douglas?
It's up around Douglas that they're the
that
there.
They had a Air Force base, and the dust storms coming over Mexico and the planes, you know, warming up and everything. Next thing they know, all these people getting sick with this tuberculosis-like stuff. So we had just gotten over a epidemic of meningitis, and then next thing we had was this silicosis thing. Our men were sent to, you were asking what part of, they were concentrating on the Pacific and the jungles and things of that
Yeah.
sort. Some of the group was sent to California for orientation. A large bunch went to Louisiana because they wanted the swamp conditions and that sort of things. But the hospitals that were there to take care of the troops, it was too many people and they couldn't do it. So they'd put them on the trains to send them back to your home base. But by the time the soldiers would ride 2.5 days from wherever in Louisiana through all of Texas and up through New Mexico back, they had started off maybe with a sore throat and nasopharyngitis and ended up with meningitis. So we had 3 barracks. Our barracks usually took 25 patients with 9 private rooms and 16, ward. We had 3 wards that were full of patients with meningitis, and then they one ward they evacuated, and the personnel that worked on it, I was one of them that worked there, they didn't let us go back to our regular barracks. We were there, we were given sulfonamide at that time as prophylaxis for that, and we were, and then one period, at the height of it, we had 6 soldiers die in a 24-hour period. And of course we had an investigation, about this. But what had happened is those soldiers being sent back, but those field stations couldn't accommodate everybody. They, just too many getting sick down there.
And they don't have the quarantine kind of facility
Right.
like you do.
Right,
too, so.
right. So I said we went through this, and then after that was over a few months later, then we start getting these patients with, first they thought it was a tuberculosis breakout, but the irritation from the dust irritates the lungs in the same way, and then they learned that it was silicosis, and we didn't have to have the same type of prevention that we had,
Quarantine. Well, you didn't quarantine and that, but in any case, it was fixable. It would just, once the dust spread away, then their lungs would repair themselves?
Yes. But it was the, sand has the crystalline stuff in it, and it irritated the lungs as they inhaled it. And see, a lot of those people that there with the airplanes and servicing or doing whatever, as the planes went out at, it's near Douglas. I can't think of the name of the place now, but anyway,
Yeah, but it's an Air Force base.
There's an Air Force base there.
Yeah, still operational, although they're shutting that down. Were there places, the men have told me that they were prevented from going places because of the color of their skin. Were there places that you were off limits?
Tucson is small. Usually, most of the things we wanted was on post. Let's say this. If you went into town, Bisbee or someplace, I was usually going shopping. I wasn't, when you have, 45,000 people in a thing, men have to find places, and they put these things in these small towns. Like I mentioned, Petersburg is not as big as your hand. They got one main, I'm not kidding you, they had one main street. Sycamore Street was one main street, and all of the bars and things there where they congregate. Now, some of the fellows that were from back east, as we say, Baltimore or Washington, if they had the weekend pass, they'd go to these places rather than there. So what can you do? Walk up and down the street. But getting back to the USO, they try to have a lot of things for the fellows to have something to do. So they'd bring young ladies from the universities, from wherever. Like I said, I was a young professional, and out they'd get some of us to go to the U.S. so they could do many things on the fort base.
And not leave
have
into
to
these
do it.
areas,
Yes,
yeah. But did you ever experience a time when you were shopping or something where you were told not to go to?
Not at this, I mean, here in, no, not at Huachuca at all. We'd go into Bisbee they didn't have much more than 5 and 10. Phoenix had a few dress shops, but by this time we were wearing uniforms, and the only thing that I'd buy would maybe they send in lovely English linen shirts. In my pride, oh Lord, I didn't want a wrinkle in it. I didn't want nothing cat faced,
right.
Nothing. So there was a big store that I'd buy shirts, and of course everything was on the post, you know, quartermaster or something, you got things. So I didn't, but you can see where men get restless and have things. That I'd go into Phoenix at night to Tucson, to night spots and things, but sometimes they'd get problems because too many soldiers, even if you weren't doing anything, it gets overcrowded. Everybody sometimes the fellas would probably have some trouble.
Tell me about, I see a picture of you with a gentleman, and he was from the 92nd?
Yes,
and you
371st Infantry Division.
And you met him in the hospital or just at one of the dances?
Probably at the club.
And where was he from?
From North Carolina.
Oh, southern, real southern.
Yes.
And so this was his first experience out in the West, but you were probably a old hand in the West. So
well, he told me that he had been with the CCC camp. And he had been places in New Jersey, and his family would go sometimes. He'd laugh and he said when things was very good, his father would take them up to Jersey to live. When things got bad, they go back to North Carolina. Now, I don't know if this was good or not. But as a young man, he went into the CCC training. You know, it's kind of like military.
Sure. It was run by military people,
right,
too,
and as a matter of fact, one of the officers that we had on one of the wards, he identified for me. He said he had been his captain when he was in this CC camp. So he had gotten accustomed to that, but of course he was drafted in the military, as many of the men were.
Right. Did you, so you had, all of your officers were white as well, right?
No, see, at the hospital, it was under a black colonel. He had Colonel Bowesfield's first name, Bowesfield, but he was from a hospital in Chicago, is where he had been head of this hospital in Chicago, and most of the residents and what have you, he asked to come with him to Huachuca. So a number of our doctors were people that he had, but they were all black doctors. Our doctors, and that was my first time working with black doctors. Believe it or not, when I was in school in Atlanta, all of our doctors were white. We had black patients. Our teachers were white. They had both a black school and, as they said, colored at that time. We weren't into this. A white school and a black school, and they were across the street from each other. Our classrooms were the same. Like if we were having anatomy and physiology, and maybe our classmates at that same level was having bacteriology or something in another room, but we used the same facilities in terms of our labs, our classrooms. We weren't there. The only thing that we had together as classes was public health. Before we were out, we had public health, and we had classes together at public health. They usually were not, but all of our doctors were being trained at Emory University, and they were all white. And our supervisors were mixed. Sometimes they were white, sometimes they were black, or one of each, you know, upper, lower case, what have you. But I had not worked with black doctors until I went to Fort Huachuca.
And it was this guy, Colonel
Field, U.S. Bowsfield.
Who's bringing in people from Chicago.
Provident Hospital. Provident, you might know, is an outstanding, has been, historically, black hospital that was established where a lot of doctors could get their training. They could do their residency and internship and stuff of that sort. So Colonel Bowsfield asked a number of his men, and of course they were all commissioned when they came to the military, depending on their years of experience. They were colonel, he was a colonel, but you had majors, captains, first lieutenants and stuff like that, depending on their medical background. They had some criteria for determining that.
Right. Your time in and your experience.
Right.
So the people who were not in the medical corps, but who were in the headquarters and all that other sort of thing, they were white officers.
A number, but we, for the most part, other than in connection with the patients, our soldiers. As a matter of fact, does Hank tell you? He was one of my patients.
No, okay. Oh, yes, he did, but overseas, right?
Yeah.
Okay,
No,
so
this was at Fort Huachuca. He was a big football star and had something happen. I think he had a detached retina, so somebody hit him, and he was a patient. And I remembered him from that. Well, when I came to, it's a long story, but I came to Cleveland, and a dentist we knew him and told me that he was here, and got to know him. But I knew Hank from being a patient. But okay, our chief nurses, our directors, as you would have, were black. They had been to officers' school someplace or the other. Like the very first one I had her orientation to officers' responsibility at Fort Bragg, North Carolina. And then she was moved on, took a cadre of nurses to Liberia. And they were there for a year, and then she came back to the States, but she went someplace else. My chief nurse came from Huachuca. They made up a cadre of us to go to Burma. You asking, did we know? We didn't know until we were in flight where we were going, and they asked us to, they open your Allied papers. I couldn't wait. I almost tore it off before there. But anyway, we they had 16 nurses, 8 of us from 10 of us from Fort Huachuca, and 6 from Camp Livingston.
Livingston?
It was in Louisiana. Camp Livingston, Louisiana. So when they assigned us to the 335th Station Hospital to go to China, Burma, India, that's all we knew. Well, we didn't even know that at the beginning. We left Huachuca by train, went to New York. When I say we, the 10 nurses, 16 doctors from Fort Huachuca by train. We were billeted at Park. Listen, I lived on Park Avenue.
Ooh,
we were billeted.
Billet.
Yeah, number 1 Park Avenue. We were there for 10 days while we were getting our immunizations and stuff for going overseas. We left New York by flight to Burma. We went to Newfoundland, the Azores, down to Tripoli, Casablanca, and into Karachi, India. The weather was bad, and we stayed there for, I forgot, we went by Egypt too, and then into Karachi. We stayed there, and then were flown into Chabua, Chabua, India. And then from there, we were taken by 2.5-ton trucks into Lido, L-E-D-O, Lido. That was the end of the rail line through India.
Yeah, I've read about it.
And at that place was like a staging area for a lot of troops. There was a lot of British troops there that had been there through the war. And I mentioned to you, I think, that we were assigned to our officers went, our officers went ahead to Burma, to Gap, to set up our hospital while waiting for our supplies to come. There was already a facility there that had been General Stilwell or Merrill's headquarters years ago. So there were bamboo huts and structures there that had been his administrative thing where our hospital was going to be. So our officers went ahead, but our men and equipment was coming by ship. So it was going to take them 6 weeks. So 6 weeks we were assigned to the 48th Evacuation Hospital that was down in Lido. Their hospital was set up in British tents. They were taking care of the Chinese 36th and 38th Division that was fighting in the lower part of Burma. Okay? So their patients had wounds of all sorts from war. A lot of them had abdominal wounds because they said they'd forget and stand up and the bullet or whatever just, right there. So we had a lot of people that they did a operation, and then a lot of them had wounds in their arm, but they attached the arm to the abdomen for skin graft.
Oh, interesting. Sure.
We had a lot of patients that had that type of thing, but the hospital was large British tents that would hold about 40 patients.
Okay.
And the patients had cots and with mosquito netting around it, and it was lined up, and like you've seen the old-fashioned army hospitals. It was like that.
Did you take like Atabrine or something for
Yes,
mosquitoes
for
and malaria?
suppression. We had to take Atabrine and take salt tablets because it was, the dehydration. We were always sweating. Temperatures was God knows how. We lived in British tents, 10 nurses to a tent, and very high ceiling. We had army cot and an army blanket, a foot locker, musette bag, duffel bag was the big thing that you've seen. We had the mosquito netting around, flashlights, because we had to have flashlights. And these big British tents had little 60-watt bulbs way up in the ceiling, and you couldn't see anything. And those frogs was hopping around. The only thing I was afraid of, I'd heard so much about those snakes and things, but I guess because of the activity, we didn't see the big snakes and the cobras and the thing. But that was what we saw. We had chameleons, though, these little froggy things.
Yeah.
Your mosquito net would move, and you look and flash your thing, has those little eyes looking back at you, and one of them clinging to it. That we got used to that. They didn't get in with it, but they told us.
And they'd hang on it.
Yeah, they'd be jumping or going someplace, and you'd feel your thing move, and you'd look, and those little eyes looking back at you. But we were told, check everything, whatever you leave, and we had to wear boots, because even when it wasn't the real monsoon, it was muddy a lot of times, and so we had boots up to our knees. And we had seersucker uniform. We were issued brown and white.
Uniform too, so.
Yeah, brown and white seersucker uniform with the slacks in the top. And our uniform was like a little wraparound brown and white that you tie on the side, but we wore our, you could wear either. You in proper uniform if you had on the dress or the pants, but most of us preferred the pants, of course, because you could put them down in your boot.
Right.
And you
Nothing to
mentioned
jump on.
about, yeah, you were talking about mosquito. Every night we had what we call scat call. We had to put on the mosquito stuff to protect us, and we were issued big nets to come over our head and down in our. Can you imagine a soldier waking up and he doesn't know where he is, and here we're standing over with all that crap on? Oh my God! I tell you, those poor guys went through a lot. You know, here we're standing with all that junk. I'm like, where am I in hell? Where am I going?
It just
And
looks like an angel there.
yeah, it's not an angel. We didn't look like it. But anyway, they told, you know, you shake everything when you take it up. You never know. If you laid it down, you never know what's in it.
Okay.
And they told us, say, if we went to bed and your boots was standing up, don't put your foot in it in case something crawled in it and its body, put it back up. But what I would do is sling mine across the room, because I thought if whatever's in there is coming out, I don't want it to come out that close to me. So I'd throw mine way across, because I am terribly afraid of snakes. But we never saw it. But what would scare the dickens out of you with that British tent, you couldn't see those little lights. And you know, you're using your flashlight all the time and all, but you make a move and a frog somewhere, oh, and oh my
Everybody's
God, you're
screaming.
jumping all the time when they're croaking. You know, you move and scare him, and he jump and you jump, and it's kind of crazy. So, as I said, for the 6 weeks we were there, and for ration duties and quarters, and we helped with the Chinese patients, dressings, and giving medication and stuff. So we were attached to this hospital. And you were asking about, there was no prejudice shown to us in this respect. There was 2 hospitals, Fort Evac, and then there had been another field hospital attached to them. So this group, the 48th Evacuation Hospital, had been a unit of people at Massachusetts General. The doctors, everybody signed up to come into the military as a unit. And so they had the orderlies, you know, and everything that were enlisted men and everything. So they came as a unit and went overseas as a unit. They went by boat, they tell us, and they were taught Chinese those 6 weeks that they were going. We picked up some words and they taught us some, and we learned enough to, you know, to ask the patient, do you have pain and stuff like that, turn, cough, you know, we were helping the doctor with an exam, cough deeply and stuff, but they had intensive classes on the boat.
Wow.
For that period of time. And then the other part of the hospital that was attached to them was a hospital unit from Missouri. And again, they had been, a number of hospitals thought of that. Let's stay together. We're going to die together. You know, we work together. Because this hospital was from Joplin, Missouri, I think.
Okay.
Missouri. And they were attached to it. So there was the 3 units. At the end of the 6 weeks, we went up to Burma. Our equipment came and our men were setting up in it, but I told you the buildings were already there. We lived in bamboo huts that had the tarpaulin strippings to hold they didn't leave us with the thatch roof because they found that too many rats and things were in it, but
God.
that didn't stop the rats. They played football every night in our barracks at at our room. My roommate and I laughed. We'd hear squeal, squeal, squeal. We said, okay, they scored something this time. They run it, but they didn't bother us, and we didn't get bitten. That was surprising. You know, we'd hear rats at night. They'd run, squeak, 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 and bang, because we only had our cots. The floors of the buildings were braided bamboo, so our floors weren't soil at that time. When we were in the British tent, it was dirt. But when we went up to Burma, the buildings had been there, and we had like the bamboo mat.
Yeah.
No, it was the whole floor, you know, like wall to wall.
Oh my God.
bamboo.
Okay.
And then our windows. But we'd hear the rats running and squealing at nights, and we got to the place, we'd laugh about it and say, boy,
Oh, you're
they're
kidding.
playing football. I was trying to find that, but that's okay. Okay. There was 2 nurses per room. We had a building that had 2 living units in it, and divided, and then across the back was like another room that we used like our bathroom. Our water was, of course, pumped in
Okay. Huh.
to a, they use a generator type thing to pump in the water that was held in a huge tank. If you've ever seen these country trains that used to have to get water at a place, have you
right,
seen that?
yeah.
We've seen what that
Right,
receptacle
right.
looks like. That's what our water was in.
They must have had to purify it, though, in
You
some
did,
way. Yeah.
they chlorinated it, and then they boiled it, and they rechlorinated. And the chlorine was so bad, when you get ready to wash your face, you had to close your eyes. So
Oh my God.
it was so, and then the same with what we drank. Like our water, as that came from the Brahmaputra River. The Indians bathed their elephants in it, washed their clothes in it. The GIs, I'm not exaggerating, washed the trucks in it, and we drank from it. So, and our canteen things would be so red sandy looking. The Brahmaputra was like the red Georgia sand. But you wouldn't shake it too much. Once it got settled, once they got it out of the Lister bag and they'd done all the stuff and everything, when you got a drink, you were